After Build the Wall, one of Donald Trump's biggest campaign promises was to go after drug companies and force them to lower prices.
And today, the president unveiled his new prescription drug plan, but critics complain his tough talk of the past is now gone. The drug companies do like it, though. Their stocks soared today.
KCAL 9 political reporter Dave Bryan joins us now with the president's plan and reaction to it. Dave?
Let's face it, everybody wants to lower the price for medication, except maybe pharmaceutical companies. The question is how to get it done. That's where the debate begins. In fact, the debate over how effective President Trump's plan will be began just moments after he spoke outside the White House. Some critics charging this was all talk and no action. Others say patients may be surprised by the impact the president's plan could have on prescription prices.
One of my greatest priorities is to reduce the price of prescription drugs.
Moving to carry out a top priority from his 2018 State of the Union address, President Trump on Friday acknowledged not much has changed with skyrocketing pharmaceutical prices.
The drug lobby is making an absolute fortune at the expense of American consumers.
In fact, the average person in America pays a little more than $1,000 a year on prescription drugs, more than any other high-income nation in the world. And that amount has nearly doubled since just the 1990s. And some drugs that might require a lifelong prescription cost tens of thousands of dollars each month. On Thursday, Secretary of Health and Human Services Alex Azar testified before a Senate Appropriations Committee and echoed some of President Trump's concerns.
Prescription drug costs in our country are simply too high. List prices are too high. Seniors in government programs are overpaying due to lack of negotiating tools.
So at the White House Friday, President Trump came out swinging with plenty of tough talk about reining in the big pharmaceutical giants and their skyrocketing prices and obscene profits.
This is a total ripoff, and we are ending it. We are getting tough on the drug makers that exploit our patent laws to choke out competition. And we will not rest until this job of unfair pricing is a total victory for the USA.
The Trump plan aims to increase competition and give private insurers, instead of Medicare, the ability to negotiate for lower prices. But some critics charge the plan doesn't make it easier for Americans to import lower-cost drugs from overseas, like some cancer drugs, which can cost patients over $400,000 a year for treatments. And the president backed off from campaign statements to have the federal government directly negotiate lower drug prices for Medicare, both of which would have sharply curbed the exorbitant pharmaceutical profits, leading some experts, like Health Access California Executive Director Anthony Wright, to charge that President Trump's presentation was more talk than action.
He felt the need to make the speech, but he didn't feel the need to actually challenge the industry in any meaningful way. There are some solutions that he could have taken on, but that would have meant taking on the drug companies, which he doesn't seem inclined to do. You know, we got an indication of that when he appointed the head of Eli Lilly to be his HHS secretary.
But Georgetown University professor David Hyman, a healthcare regulation analyst, believes the plan may be more effective in reducing medication prices than the skeptics are expecting.
The surprise is how comprehensive the proposals are. They're actually trying to look at a whole bunch of different aspects of drug pricing. Rather than one big thing, it's a lot of small things, which, as I said a moment ago, could well add up to a big impact on drug prices.
Democrats are wary.
I think we can all agree that these prices have been running rampant for too long. But the question is not what you say about it, no matter how tough your language, it's what you do about it.
Now, perhaps the most accurate indication of who will benefit from the president's plan is to follow the money. And tonight, it's pretty clear. Shares of several major drug and biotech companies rose just minutes after the speech. The NASDAQ Biotechnology Index finished nearly 3% higher on Friday. And CVS Health, a pharmacy benefits manager, gained more than 3%. Jeff?
kind of wonder who it's going to benefit.
Pretty clear, huh?
So I got a couple of questions here. Why is this happening now, and what
Yeah.
impact may this have, down the road?
Yeah, well, now we're looking at the political side of this whole issue. It's coming up now because of two reasons. President Trump needs to defend his administration from charges from Democrats that Americans are losing health coverage and paying more for medications because the president is sabotaging the Affordable Care Act. And second, because the midterm elections are less than 6 months away, and the balance of power in Congress could be changed depending on issues like this. The rising prices for pharmaceuticals are affecting millions of Americans, many of them core supporters of Mr. Trump. If he loses them on this issue, well, it could have a dramatic impact on who controls Congress, Lena.
All right, Dave, thank you.